So I'm done with my surgery. I'm really high right now. It's not too painful. Like a lot of people said it was like excruciating pain, and some say it wasn't too bad. I mean, it's a decent amount of pain. Nothing that most people wouldn't be able to handle. It just feels like you did a really big workout, like with your stomach muscles, and then like the skin is mostly numb, so I don't really feel anything that's really tight. I don't really feel much but pressure. The only other thing is my throat hurts because they put like the breathing tube in there. So I guess it's not even like it hurts like it's sore. It's just I gotta build up like a loogie. So I keep having to cough to try and get it up. But other than that, I feel fine. And I just had my surgery a few hours ago. Sorry. I show you my drain if I can show it. Not that much came out, and because I don't have that much, they only gave me one. So for the squeamish, don't look. And that's all I have for that. I have a whole bunch of medication I'd show you, but I can't really reach across the bed. Look at my hair. Oh my gosh. I look like Bozo the Clown, so I guess I'll just leave it like this so you can't really see it. I gotta cough again. I also have this over here. That pump thing at the end of my bed. And it squeezes, I don't know, did you get to see it? Can you see it? The pump? Yeah. Well, it squeezes my legs. Every like every couple seconds or so, and it starts pumping. And of course, most of you know that it's to keep my blood and everything circulating properly, and so I don't get blood clots. And then that's also why I take those shots to help with blood clotting as well. Most doctors don't do it, but he was like, if I could lower the risk even more, let's do it. So I'm like, let's do it. So I got to give myself shots for 10 days, starting tomorrow. They're going to show me how to do that. My drain is actually a lot easier than most people's drains. Most people, they just they pull off the tube and they have to pour the stuff in like the toilet, causing them to have to get up to empty it, which, I mean, it's good because they do need to walk around, but mine is just a spin, like, it's just a cap, like, right here, I'll show you. Like, there's this little thing right here, kind of like when you blow up, like, a balloon or a bed or something, this part pops off, which releases all the air and the pressure, and then you just squeeze it into a cup or something and then throw it away. You don't have to worry about getting up all the time and stuff like that, but my mom's doing all that, so thanks, Mom. So that's pretty cool. And this tubing, like a lot of people say they had to squeeze the material out the tube, but with this one, I guess it's much more advanced, or a different type of tube, and you don't have to. All of it ends up into the thing. It automatically. I don't have to worry about it at all. Another thing is that a lot of people were saying, oh, I'm trying to sit up straight, it's almost 2 weeks and I can't stand straight. Well, don't force yourself to stand up straight. My doctor said it's important that for 2 weeks you don't stand up straight. You need to be hunched because your skin is taut. It needs to relax before you try to start standing up straight. So don't start standing up straight until you're 2 weeks. I mean, it's not that hard to stand up straight for me, but obviously I'm going to take the doctor's advice and not stand up straight. I mean, I don't want to pop open my stitches. That's kind of retarded. I mean, it makes sense. I mean, why would you want to stand up? You have an incision that needs to stay closed, and if you stand up straight, you're forcing that pressure and the stretching and stress on your skin. So just don't do that. But it was really nice. The facility was really nice. I got to go into a really nice warm room. They put what was called a bear hugger on me to keep my temperature up, which no one's ever mentioned that before, that they've had that. But it's like this, they put on like a regular like sheet blanket, like a regular bed sheet, and then on top of that is this weird looking, like, it's kind of like thin plastic material on the very top where the air blows through, but underneath it's this thicker material. I guess that's to I'm so high. The bed sheet protects me from getting too hot, like on my skin, obviously. and then like the air blows through, and it was so good. I fell asleep, and they dimmed the lights. So I'm like, dude, if I could have this every day, this kind of treatment, it'd be awesome. Who couldn't go to sleep to that? And I have like sleep issues. That's all I have to report. And I have a breathing apparatus, called a spirometer, and I have to hold the little ball when I suck in. I have to hold the little ball up for like 3 seconds at least, because that's how I have to breathe. They want to make sure that I'm getting enough oxygen to, obviously, my scar, which you think about it, the more oxygen my scar gets, the better it'll heal. So obviously I'm going to definitely do that. I guess I can make another video in a little bit, I guess, to show you how I'm getting around and stuff, but I walked pretty fine. They had me stay at not the hospital, but the clinic for about an hour or so after surgery, I think. I'm not too sure, maybe 45 minutes. And yeah, so I was able to walk around pretty much on my own. I was a little dizzy, but I was able to walk around on my own, and I felt no pain. I felt a little bit of pain just recently, about half an hour or so ago. My mom gave me some of my medications, like oxycodone or something like that, so I got that, and I feel fine. I mean, yes, it's a little sore and stuff like that, but it's not unbearable pain or anything, so everything's good, I think. I'll give you a call back. Well, hello, anyone there? No. I'll message you guys underneath to give you a little bit more brief description, and I'll make another video when I'm trying to get up and doing something else. Have a good day then. Bye, guys.